Diabetes is a disease that was discovered over 10,000 years ago by a Greek physician, Arteas of Cappadocia. He used the term diabetes, meaning siphon or flow through, for a disease in which the water a person drinks runs rapidly through his or her body. Englishmen John Rollo and German Johann Peter Frank used the term mellitus, meaning sweet as honey. So putting the two words together, diabetes mellitus, means a person who drinks too much water and urinates frequently has a sweet, glucose-saturated urine. Glucose is an aldohexose, a monosaccharide, and a complex carbohydrate. Each carbohydrate contains carbon, hydrogen, and oxygen atoms. Glucose specifically contains 6 carbon atoms, 12 hydrogen atoms, and 6 oxygen atoms. Hi, I'm Laura, and I'm the physician that's going to help each of these patients with their condition today.
Hi, I'm Nicole, and I have gestational diabetes, and I can thank my baby for that.
Hi, I'm Lorraine, and I have type 2 diabetes, and I can thank my own lifestyle for that.
Hi, I'm Jessica, and I have type 1 diabetes, and I can thank someone in my family for this.
Foods are broken down into 3 essential nutrients: proteins, fats, and carbohydrates. When carbohydrates are digested, the carbs break into glucose molecules entering the bloodstream. Once glucose molecules enter the bloodstream, your pancreas secretes insulin, which in turn binds to each cell and acts as a key unlocking the cell door, allowing glucose molecules to enter the cell and be used for energy. Even though insulin is the key to a cell's doorway, excess body fat can build up and block the entrance of glucose molecules.
If you're diabetic, your pancreas does not secrete sufficient insulin to allow glucose molecules to enter your cells, leaving you feeling tired and weak. Your body's natural reaction to the accumulation of glucose in your blood is to extract water from your cells, leaving you thirsty on a constant basis. We all know what drinking plenty of fluids does to us all.
I was pricked on the finger, so the physician was able to collect a small blood sample. My blood sample was placed on a test strip and inserted into the blood glucose meter. Within seconds, the device displayed a blood glucose level of 185. I was prescribed metformin, which is an oral medication to assist in lowering the amount of glucose in my blood. I was also informed that keeping my condition under control is vital because it can lead to other serious illnesses.
I was diagnosed with type 1 diabetes in 2010. I knew nothing about diabetes and having to maintain it. I had been out of insulin for over a week, and I had to see the doctor for an insulin refill. During my visit, I felt extremely nauseous. I was weak, tired, and scared. The doctor prescribed me what I needed, and we talked about how this change has affected my entire family. My doctor explained to me that it's hereditary, and if I didn't change my lifestyle completely, it could lead to an early death. I began cutting out all the soda, chips, candy, and fast food from my diet and replacing it with well-balanced meals. We take family walks after dinner 3 times a week and 1 weekend day. My children are now exposed to a better diet and lifestyle. I know I may pass this gene to my children, but my goal is to teach them how to make better health choices.
I went in for a routine checkup at 28 weeks. My doctor noticed some symptoms I described seemed all too familiar to her. I explained to her I was more hungry than usual, and yes, I know, I'm eating for 2. My dry mouth and constant urination seemed more of a problem lately. She explained to me that she needed to give me an oral glucose tolerance test. I was to drink it and have my blood drawn every 30 to 60 minutes. When I was presented with my lab results, I was diagnosed with gestational diabetes. In order to keep my baby and myself healthy, I have to maintain a strict diet, exercise at least 30 minutes a day, and drink plenty of water. If I do not maintain control of my condition, I can develop type 2 diabetes.